Hi everyone, we are Ashton, James, and Taylor, and we will be discussing substance use disorders and the importance of clean needles. The United States has a serious substance misuse problem. The use of illegal drugs or misuse of prescribed medications increases harm to those who use them and those around them. These harms produce a financial burden on the country. Not only do they hurt us financially, but they deteriorate the quality of health, education, and social systems. These disorders are killing us, with tragedies such as substance use-related automobile accidents, drug-related violence or crime, and overdoses. Many Americans believe that there are no solutions for the substance misuse going on in the country. Rather, they believe it is a lifestyle issue due to poverty and ignorance. Although it can be considered a lifestyle issue, there are efforts that can be made to reduce the harms and costs associated. Science has found and produced many interventions, such as medications, behavioral therapies, and recovery support services that help even those with serious addictions make recovery. Changes in healthcare insurance and financing has allowed more ways to aid in prevention and treatment of substance use disorders that were not previously possible. This crisis should not be looked at as expensive and devastating to society, but rather should be seen as ways to prevent and intervene early in cases of substance misuse with effective, practical, and sustainable practices. Those who use contaminated needles to inject drugs are more at risk for diseases such as viral hepatitis B and C, HIV, and endocarditis, or a bacteria that causes heart infections. In fact, most cases of Hep C and HIV are caused by using contaminated equipment for drug use. Hepatitis C can be short-term or long-term. More than half of hepatitis C cases are chronic, which can lead to scarring of the liver or cirrhosis, chronic liver disease, liver cancer, and even death. Symptoms of Hep C generally include chronic fatigue and depression. HIV is a virus that attacks the immune system. Once someone gets HIV, they have it for life. There are effective treatments to manage the disease, but there is no cure. Without treatment, HIV will progress to AIDS, which has a survival rate of about 3 years. Symptoms of HIV include flu-like symptoms such as fever, chills, muscle aches, sore throat, mouth ulcers, swollen lymph nodes, etc. Use of sterile needles has been found to be the safest and most effective way to prevent HIV transmission while injecting drugs. Approximately, there are 900,000 people in the United States who live with HIV/AIDS. More than a quarter of these cases are directly related to injection drug use. There are about 185 needle exchange programs operating nationwide that exchange sterile syringes and needles for contaminated and used ones. It only costs the average city about $20 per user per year to run a needle exchange program. It's interesting to know that it is illegal on a federal level to run needle exchange programs on federal funds. In recent years, needle exchange programs reported removing over 25 million contaminated devices from communities across the U.S. Since establishment of needle exchange programs, many communities reported a decrease in new HIV/AIDS cases by over 1/3, or 33%. The link provided here is the local needle exchange program schedule. Let's learn how to sanitize IV drug use supplies. Here's a video for those communities without needle exchange programs. The video shows that by using water and bleach, we can sanitize IV drug use supplies and reduce the risk of transmission of hepatitis and HIV. If you or someone you know uses IV drugs, please share this information. And here are our references. Thank you so much for your time.